How do you approach end of life care for someone with dementia? Well, tough one. End of life care is difficult for anybody going through any condition, because it is a time when, in a lot of cases, the person is aware that it is the end of their life. With somebody with dementia, it's not always the case that they are aware. So they are not even aware that it's the end of their life. Whereas the family is aware, the professionals involved are aware, right? So it's a very strange situation to be in. Symptomologically, the symptoms are very similar to people with other health conditions who are at end of life. So it's very similar. The palliative care that is given to people with cancer, people with AIDS, people with other kinds of terminal illnesses, is very similar to those with dementia. You need to ensure that if they are immobile, if they are bedridden, that ensure that the body is kept safe. There are no bed sores. They're not wetting themselves and getting rashes. That they're getting enough physiotherapy, movement to ensure that there's blood circulation. They're getting moved from side to side so that the body doesn't form, pressure sores. If there are issues with eating, swallowing, drinking, then a decision to be made on what has to be done, because not being able to swallow or chew towards the end stages of dementia is quite common. So either we give them pureed food, or we figure out if the family is willing, then to need to intubate them, to put the food through a tube, through that down into the stomach. So there are some major decisions that actually need to be taken at end of life. And while in a lot of countries across the world, people actually write down these things a lot beforehand, when they're still sane and they're young and they're able to comprehend what they would like done with themselves when they are at the end of their life. It's not so much the case in India as yet. So usually it's the family that's making the decisions, and it can be very difficult because these discussions don't happen in our household. These are not dinner table conversations, where we discuss how a person would like to be taken care of when they're at the end of their life. Would they want to have a tube stuck into them to be fed? Would they want to have a catheter if they're not able to pass urine? Would they want to just lie in bed? Or would they want to be home? Or would they want to be in an assisted living center where they feel that they're not burdening any of the family members? A lot of these questions are totally hanging in the air, and the family makes an informed choice based on what they think is best for their loved one. And we as psychologists, we go along with the family's wishes. So once again, it's a lot of hand-holding. It's a lot of bringing awareness to them about what each of these decisions that they make may actually entail for the person who's enduring it. Because what happens is, then we have to actually become a voice for the person with dementia. They may not be able to say that I don't want a tube stuck down my throat. I would rather just pass away with starvation. They may want to say that, but they can't. And so the psychologist has to make the family aware that this may be one possibility. And could it be that your parent or your spouse may actually want it that way? So it is essentially trying to ensure that the person who is suffering from dementia is treated with as much respect and care and sensitivity as they would have been if they were just anybody else going through a terminal illness, where they had a choice to voice their own choices, right? So yeah, that is I think the most important thing about end of life care for someone with dementia, for us to be sensitive to that.